Hi folks, this is Hariam for CBNR. Today we are going to do a small update on Bell's palsy, even though I've written it as facial palsy. Mostly I'm going to talk only about Bell's palsy. Right, so I'm going to do in two parts so that we can have a rather smaller videos rather than large ones. Now, the first thing we want to just remind ourselves is that the cranial nerve is sort of, the cranial nucleus is sort of the anterior horn cells, if you will. So they are the lower motor neurons, and they give out the your cranial nerve, which supplies your muscles of your face so that they can function to your oromotor function and facial function of your face. And because it's a motor nerve, they have to have connections from the cortex, especially from the motor cortex. So you'll have your corticospinal tract coming from up, and then they go down, they decussate, and they innervate your seventh cranial nucleus, right? And because it is also has it's a motor connection, it's a motor nerve, so it has to have connections from your upper motor neurons, right? So that is your cortical spinal tract. And also remember, the face is sort of, you can have some involuntary movements, if you will. They are not exactly involuntary, but we'll, just for the sake of understanding, we'll call it as involuntary. What it means is that a lot of our movements are not exactly under our control, right? So when you're angry, when you're laughing, the muscles which are activating are rather not exactly under your control. We have been talking about your limbic system, which controls your emotions and things like that. They also have a control over your cortical system. So along with your context, your facial muscles are producing facial movements via this system, that is your central system, activating to your limbic system, right? So what's the value of all these things? You can see that by a simple example, you can have two types of smile, right? The fake smile and the real smile. And the fake smile is basically your voluntary smile, and the genuine smile is your sort of involuntary smile. What I mean by that is, if I do this, if I see somebody and I say, do this, right? Just do that. That's your fake smile, which is basically by your zygomaticus and things like that. That your muscles around your face going like this, right? But if I'm really smiling, right, you can see that my eyes get smaller. A lot of muscles activate to produce that genuine smile. One of the earlier findings of Duchamp, who did electrical stimulations of this muscle, zygomaticus, produced this smile. And when he talked about genuine smile, he said that there are a lot of muscles which are involving. A great biologist, anatomist, who worked on muscles and dynamic muscles. One of the myopathies, Duchenne myopathy, is named after him. Right? So that's it. So what it means is there are two types of facial palsies. So what it means, all these means is there are two types of facial nerve lesion, that is your element and human lesion. And one of the easiest way to differentiate is that in case of element lesions, whenever you ask them to smile, they have to go like this, right? The mouth goes towards one deviation. Also in central deviations, like in stroke patient, when you ask them to smile, they go like that only. right? Even when they are talking, they go like this, right? The mouth deviates. The only difference is when they do a genuine smile, right? When they laugh. In case of element lesion, then also it goes like this because there is no connection properly. But in case of central lesions, right, they go like symmetrical when they are doing a genuine smile. That's one of the ways to differentiate between peripheral lesion or human lesion and element lesion, right? So in this, I'm going to talk about only about lesions which are, as I told you, this is a supranuclear lesion and these are element lesions. In this, I'm going to talk mostly about this part of it, that is your element lesion rather than upper motor lesions, right? This is what I was talking about. If you ask them to show the teeth, they will be asymmetrical, but if you tell them a joke, they will smile, right? If you have a central lesion rather than a peripheral lesion. Okay, so we are coming to our the part which we were about to talk. That is Bell's palsy. You can any element lesion can be because of all these reasons which I have enumerated. Only difference in a Bell's palsy and another element palsy is that the reason for it should be idiopathic, right? You don't know what's the reason why you are getting this. That's why it's called as Bell's palsy. Remember, most of them recover. Sometimes they will have residual paralysis. And the risk factors can be viral infection, vascular, ischemic, autoimmune, whatever, any of these things leads to one important thing, that is you get inflammation of the seventh cranial nerve, right? You can see that here it is clear, you can see it is sort of inflamed and things like that. Here it is inflamed, here it is clearly, you can see that the line is going here, it is inflamed here, right? So this inflammation is the pathology behind your Bell's palsy, but we don't know the etiology. And these are some of the factors which you can see in your patient and say, okay, these people are going to have some amount of residual palsy, right? The older the patient, residual palsy may be there. If they have pain here, right, if they have pain in this region, and if they are not able to taste, the taste is impaired, hypertension, all these things may have limited prognosis. You know all the symptoms about facial palsy. One side muscles are not working, some amount of problems in salivation also, probably pain also, lacrimation also may be affected, and later symptoms are persistent asymmetry, hemispasms, that is muscles are getting tighter, synkinesis, and social and psychological issues. What I mean by synkinesis is if you do one, if you are doing one moment, that is, if I do a smile, I'll automatically go. Something will go into something will happen to my eyes also. They also get smaller, right? Why I'm talking about synkinesis is that's one of the latest symptoms which leads to all sorts of issues. So one of the common examples you can see is if you go and see Janaraj in all movies, you will see them very well. One of the issues of synkinesis is crocodile tears, because when the nerve recovers, right, when they are recovering, rather than growing to the right muscles and the right places where they have to, they will grow into, or they will give branches into other parts also, right? That is why you get synkinesis, and that is the reason why you get what we call as a crocodile tears, because the nerves which are supposed to go to the salivary glands, right, they may go and innervate your lacrimal glands, so you get this crocodile tears also. Because of the way they look, they may have psychosocial issues. One of the important things which is being talked about is symmetry, right? If you are symmetrical, if you are looking similar to in both parts of your face, it's considered to be more prettier, and it's a sign of healthiness and things like that, right? One of the reasons why all our athletes look stunningly pretty, right? Now, here's a photograph of a person. You can see there are two photographs. One, he has Bell's palsy, right? So you can see that he is asymmetrical this way you can. And what I have done is I have sort of made a symmetrical photograph of him by cutting into half and putting it like a mirror image, right? This is not his real picture, it's a picture which we have made. You can see that he looks softer, he looks healthier and things like that, right? So, because of the way they look, they may have psychosocial issues. What it might be is they don't want to go out, they want to take leave and stay. If it is in children, it's a huge headache. They really don't want to go out with the friends and things like that. If it is persistent, a lot of people may have psychosocial issues like going out and socialization, that kind of issues, right? So that's the first part of our Bell's palsy, which is basically what's Bell's palsy, how it affects and things like that. So there are two things I want to remind. Bell's palsy is basically element lesion without knowing the reason, and it will have sensory motor issues and psychosocial issues, right? Thank you. Looking for a second part of your video for treatment for Bell's palsy. Thank you.